Well, some new concerns today for expecting mothers. The CDC sounding the alarm about a shift in the number of premature births. Experts say preterm births are up 12%. That's any birth before 37 weeks. Early term births are also up 20%. And full term, that's 39 to 40 weeks, is down 6%. Women going into labor in their 37th week of pregnancy has jumped a whopping 42%, while those carrying to a full 40-week term has dropped 17%. The CDC notes that the risk of preterm births only go up the older the expectant mother is. Formerly called a geriatric pregnancy, women at a more advanced maternal age are at far higher risk of health complications during their pregnancy. Dr. Jessica Sheperd is a board-certified OBGYN in Dallas, Texas. She joins us now live. Doctor, it's great to have you here. An important topic.
Thanks for having me.
Yes, wonderful to have you. So experts say any birth before 37 weeks is too early. Why are we seeing now fewer women carry to a full term?
Well, I think that there's two kind of discussions that we can have with this is that one, we are seeing more preterm deliveries or before 37 weeks, which is early term. And then also you had mentioned talking about the health of the mother as she starts to age, meaning she has her child or has the pregnancy at an older age. So going back to, again, why we're starting to see these changes in our preterm deliveries, and that has a lot to do with, again, the health of babies, why they're going into preterm labor, and also maternal health during the pregnancy is also a risk factor as well. So we have two things that can increase that risk, meaning maternal health and maternal age as they're going through pregnancy, and also in vitro fertilization, which has seen a little bit more increased risk of preterm births than if you were not to have in vitro fertilization.
So this shift is especially alarming for women at 37 weeks, a 42% increase there. How significant can the health risk be for the baby as well?
Yeah, that's probably the most important part of when we think of preterm delivery. You know, as an OBGYN, we're always striving to get as close to 40 weeks as possible in a pregnancy. So what you'll see typically with babies that are delivered prior to that 37 weeks, or even if it's in the 20s, is you're going to look at lung maturity as probably one of the most high complications that we see with preterm deliveries, because the lungs really haven't matured and developed in order to substantiate the fetus or the baby after they're born to really have healthy lung. And a lot of the things that we think about in preterm delivery is not only at birth. We are really looking at long-term complications down the road, even into school age years. So this really has some ramifications during the pregnancy, immediately after delivery, and then also into long-term care too.
So the report does note that it isn't an exact science always when a doctor determines how far along a woman is. Can
Yeah.
some of these rates be skewed then by human error, do you think, doctor?
Yeah, there are a lot of things. So when someone presents to the OBGYN, which is why we are always stressing to come as early as possible. So if you have someone who's a little bit further in their pregnancy, it is a little bit harder for us to ascertain how far along that pregnancy is. And then we did go through what we would say in the recent past, where there are a lot more inductions of labor and really having people maybe just get to that 37, 38 time frame and inducing their labor. So again, we start to see some of the things that, you know, in medicine that we can course correct, but also in, you know, for our mothers is making sure that we get prenatal care as early as possible, because that's when we're able to do the best of interventions, have the best care for both mom and baby, and making sure that the pregnancy can go as healthy as possible.
So we have about 20 seconds left, but I'm curious, socially many women are choosing to build their careers before starting a family, resulting in more women giving birth later in life. Is that playing a significant role in why we're seeing the preterm births rise in the older age groups?
Yeah, there are a lot of implications when we think of maternal health and waiting till you're a little bit older. And you mentioned it too, but we look at hypertension, gestational diabetes, and these are things that, again, can escalate the health of the actual pregnancy. And that's where you can start to see maternal health that deteriorates throughout the pregnancy, and then also impacting the fetus, which can lead to preterm delivery.
All right. Right, important information to have. Dr. Jessica Sheperd, thank you for being here.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.